Done, sir. Start. Sahana vavatu सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै। ओम शांति शांति शांति। Good afternoon all. Myself, Dr. Sachin Kapse, Professor, KRIYA Department of Loknete Rajarambapu Patil, Ayurvedic Medical College, Hospital, PG Institute and Research Center. On the occasion of birthday of Honorable Nishikant Dada Patil, founder member of Prakash Shikshan Mandal, Islampur, we have arranged a national webinar on Nadi Pariksha. As we all know that we are students of Ayurveda from the starting of first year. One thing that we decide, our target is to treat that patient. Every time we have a target to treat a patient, to give him normal life, healthy life. Healthy life means giving his physical, mental and social well-being is our always motto. As per Ayurveda, Vata, Pitta, Kapha are three doshas. They have to be in their normal limits. And every students, every doctors, every Vaidya should have a target to maintain his patients or his colleagues or any individual to maintain his doshas within normal limits. Because doshastu rogastu dosha vaishram, dosha samyam arogata. So likewise, in modern science, there are different tests that we use for analysis of a patient's health or diseases, just like X-ray, sonography, lab test, CBC, urine, blood culture, etc. These tests are always evolving or they are updating themselves. As our Ayurveda is oldest science, it is not missed in our science that we should examine the patient with different entities. Just from starting from Maharshi Kanath, it is always said that Maharshi Kanath emphasized more on Nadi Pariksha. Coming down, Ravana has also stated his book, just like Ravankrut Nadi Pariksha, Nadi Vidyan. Chokhamba Orandela has just published his book on Ravankrut Nadi Pariksha. Coming down that, Lagutraye, Bhav Prakash, Sharandhar and Yoga Ratnathar has immensely worked on Nadi Pariksha. But this Nadi Pariksha has limitation that we cannot understand easily. This limitation is not of the Shastra, that limitation is of our mental or our limitations of our brain. Because we have many lacunae in our spirituality, holistic approach towards the patient, and lacunae in the studying or concentration in the studying of our various science, this difficult science or immense or holistic science. To emphasize or to study this Nadi Pariksha, we, Department of KRIYA SHARIR of Loknete Rajarambapu Patil, we have thought just we can arrange a webinar on this topic. So we started this meeting taking in mind that we should emphasize or show some light on this topic that is very difficult for students and some Vaidyas also. So now I invite Dr. Kanab sir for a brief short words. Now Deepali Patil madam introduce our speakers.
Good afternoon all. I welcome all the dignitaries, speakers, teachers, students join for this webinar on Nadi Pariksha. I would like to introduce our first speaker of today's webinar, Dr. Ashish Sharma, Assistant Professor, Government Dhanvantari Ayurveda College, Ujjain, Madhya Pradesh. He is having 13 years of teaching experience in KRIYA SHARIR. He is well-known personality in Ayurveda. I request Dr. Ashish Sharma sir to continue his topic, concept of Nadi Pariksha in Ayurveda. Please, sir.
Am I audible, ma'am?
Yes, sir.
Okay. Very, very thanks to organized committee to give me the such opportunity to share my view on the topic of the uh, concept of Nadi in Ayurveda. We can we can divide it the concept of Nadi in three parts. First part is Vratai Kal. Second is intermediate Kal, where different type of medicine therapies are come there. And last part is our Lagutrai Kal. Lagutrai Kal. So I want to share my PDF. That's so easy to uh, convey my message to everyone. Please allow to screen share, please.
Yes, sir.
Screen share them.
Screen share.
Host disable participant screen sharing.
Screen share by.
Sir, share your screens, please.
Yes, sir. Sir, you can share your screen.
Okay. This. Today's our topic is concept of Nadi Pariksha in Ayurveda. Screen share हो गया? नारायण? Yes. नीचे में. हाँ, okay.
No, sir, you can open your PDF file.
Ma'am, I just open. Narayan, हाँ, first. मैम is PDF फाइल शो हो रहा है मैम आपको?
Yes, sir.
No, no.
No, no.
No, sir. We can see only your
We can see
browser.
only list of documents. We can see only list of documents.
वापस शेयर करना नारायण होगा. शेयर हो रहा है. यहाँ से. इसका फाइंड मैं अब शो हो रहा है PDF.
No, sir.
मैम for the my side I share the my PDF. नेट क्लिक करना डेस्कटॉप से भी क्या डेस्कटॉप पे कहाँ से कहाँ पेन ड्राइव से देखिए पेन ड्राइव से बोलो हाँ मैम हाँ मैम हाँ हाँ सर एक मिनट सर ये मेरे टेक्नीशियन से बात कीजिए देखते हुए सर स्टॉप
शेयर स्क्रीन पे क्लिक करते
शेयर स्क्रीन
हैं
पीडीएफ है
अभी पीडीएफ चालू है पहले पीडीएफ है
अच्छा
जी
पहले इसको पीडीएफ ये फाइन फाइनल
जी पीडीएफ जी अब स्क्रीन पे आ रहा है सिलेक्ट क्या करना है
शेयर सकते हैं
तो शेयर तो ग्रीन ऑप्शन आई रहा है
इसको शेयर करना
शेयर स्क्रीन जी इसको सिलेक्ट करो ऑप्शन आ गया शेयर 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 विथ विंडोज शेयर
शेयर
विथ
स्काइप शेयर विद स्काइप है
शेयर विथ स्काइप शेयर विथ विंडोज
उसके बगैर
एक सिंपल शेयर लिखा फिर शेयर लिखा
सर आप इधर मेल कर दीजिए
मैं आपको व्हाट्सएप
शेयर कर देंगे
मैं आपको व्हाट्सएप कर दूंगा सर वो प्रमोद सर के उस पे व्हाट्सएप पे
ठीक है सर
हाँ मैं व्हाट्सएप कर रहा हूँ सर अपन जो पहले टेक्निकली मेल भी कर दिया सर मैंने आपको। शेयर हो रहा ना अपनी स्क्रीन। हो गया, ये अपनी स्क्रीन जानी चाहिए। अपन ने भेज दिया हमको। ये तो टेक्निक फाइल नीचे नहीं जा रही।
Sir, screen is visible now. Your screen is visible.
Okay sir, so my topic is ready sir.
Yes sir. आपके यहाँ से ही सर आप नेक्स्ट पेज कर सकते हैं.
ओके सर, नेक्स्ट हो नहीं रहा ना सर, यहाँ से नेक्स्ट हो नहीं रहा सर.
सर स्क्रीन पे क्लिक करके एक बार कर दीजिए.
ओके
नेक्स्ट पेज.
सर एक मिनट.
सर यहाँ से कर दिए आपके.
ओके थैंक यू. ओके थैंक यू. टेक्निकल सर.
Screen is shared, sir. You ask for next, हम next कर देंगे.
ओके सर, तो मैम प्लीज स्टार्ट विद द नेक्स्ट स्क्रीन. फर्स्ट वी स्टार्ट फ्रॉम द भ्रातृ. Next is the use of term Nadi in classical Ayurvedic literature. So as we can say, the Charak, Sushruta, many of the literature use the term Nadi. As you can say, Charak Samhita, Sutristan 1513, Nadi Varn, Nadi Swed, Navinal, Nadi. Sushruta Samhita also reference and use the term Nadi Yantra, Nadi Varna, etc. Next. Next, this is the references of Bharat, where the Nidan Stan, Sharir Stan, Chikistan, most of the chapters they use the Nadi term most of time, but as a technical term used, not for the clinical or a diagnostic tool. As you can say the Nadi Yantra, Nadi Varna. Next. Slide. Back please. As we can see that most of the time the Bharatre use the term Nadi as a word Yantra ityadi, but they never be used and described detailing about the Nadi as a diagnostic tool. It is quite evident that nowhere the Charakushodal there is any mentioning of the Nadi as a meaning of diagnosis. The fourth chapter of second section of Hari Samhita available to present indicate prognosis only in the symbolic form. तो हम ये कह सकते हैं कि बृहत त्रयी में के अंदर नाड़ी टर्म काफी बार यूज की गई है, पर उसको एज ए डायग्नोस्टिक टूल कहीं भी उसको रेफरेंस के रूप में उपयोग में नहीं लाया गया. बट द लघुत्रयी और बृहत्त्रयी के बीच मिडिल पार्ट एरिया में ग्रीक, अरेबिक और अन्य चाइनीज मेडिसिन टर्म्स आई, जिन उनके इन्फ्लुएंस से कई हिस्टोरिकल एविडेंस इसे पाए गए, जिसमें कई हिस्टोरिकल पर्सन दे आर से दैट द आयुर्वेदिक नाड़ी टर्म्स influenced by the others medicinal treatment therapies. Next, pulse is other system of medicine of the world before the introduction of the Ayurveda. This is the concept of other therapies. They claimed that the Nadi of Ayurveda is influenced by the other medicinal treatment therapies. First of all, we go to Egyptian pulse lore. There is a they have two theories, Eben Smith or Eber Piper's theory. They first time introduced the probing with the fingers or manipulation with the hand, the observation of heart by means of the pulse. They first time using the pulse on the record, or before 2500 years before the pulse appear in Greek medical treatise. ग्रीक मेडिसिन से पहले 2,500 वर्ष पूर्व इजिप्ट में पहले ही पल्स थ्योरी को डेवलप करने का एक प्रयास किया था, जो ये एविडेंस में अप्रूव्ड है. नेक्स्ट ग्रीक पल्स लॉ. ग्रीक थ्योरी first time they established the proper way of the pulse. In the Greek system of medicine, Galen is seen to have written several treatises on the pulse according their length, breadth, and depth of the. He described over 27 varieties of them. In the addition, he also classified unequal pulse according to their rate and mentioned again 27 variety of the basis of axioms. He expressed the mention of the slow, fast, regular, irregular, strong, feeble, wave, and ant-like. Galen mostly concentrate the nadi from their quality, not the quantity. So he always prefer the quality of the nadi, not on the quantity. Next, Chinese pulse rule. Chinese, according to spread of the Buddhism, mostly students come here to for further study in Nalanda, etc. Or most of our students go spread all over the world to expansion of the Buddhism theories. As we can see, the most of the examples. Students, they come from the China to study here, like Buddhist, Bhadra, Kumar Jiva, Paramartha, Jin Gupta, Bodhi Dharma. The Indian scholar want to went to the China, not only the carried many Sanskrit manuscripts with them, which they translated into Chinese, but some of them also wrote the original book in the Chinese language. First student mentioned by the Nehru, Kashyap Batang, who is reached China in 67 AD in region of the Empire of Ming. Many Chinese scholars also come from the India, like Fa Hin, Sung Hu, Xuan Sang, Ai Xing. They four students very brief. They studied the very brief in Nadi Pariksha, and they established their personal theories. The first three, the Ai Xing claimed that his country was never suppressed by any other country to skill of the feeling in the pulse. Next, please. Next. This is the chart where we can see that how to Chinese express or assessment the nadi. They also use the three finger, but they use finger both the left and right hand. They always use the pulsation feel in a two types, superficially or deeply. So as you can see, left hand first finger tarjani, madhyama or anamika. So first tarjani seems small intestine or superficially or deeply hurt. Yes, next for secondary gallbladder and liver. Third for bladder and kidney. On the right hand, they feel the visceral organ, large intestine and lungs, stomach and spleen, heart and circulation of blood. So our theory on depend only Vata Kapha assessment, but they conclude their theory with the visceral organ identification of the position, what the healthy condition of their visceral organ. Next, this is the opinion of different student of Chinese. Wang Shuhu, Ni Ching, Golden Chamber, Li Xin Chen. उन्होंने किस तरह से कितना एज्यूम किया, उनका तरीका यही रहा कि हर फिंगर को उन्होंने दो टाइम सुपरफिशियल और डीपर दो फेज में उन्होंने स्टडी किया है. तो अपनी अपनी ओपिनियन के अनुसार उन्होंने हार्ट को, या जिस तरह से हम पुराने वैद्य मानते थे कि हम उंगली को पल्स के द्वारा शरीर के अंग के बारे में डिफरेंशिएट कर देते थे कि लीवर खराब है, आपकी स्प्लीन में दिक्कत है या आपका स्टमक में दिक्कत है. वो चीज ही चाइनीज जो पल्स थेरेपी है उन्होंने उसको डेवलप किया और वो इस चीज को क्लेम करते हैं कि दे एस्टेब्लिश दिस थ्योरी. नेक्स्ट, this is the continuation of the next page, left and right. Next, Arabic pulse lore. This is the Unani therapy, or it developed in the two phase, Muhammad Ghaznavi and the Kutubuddin Aibak, and they term the use nabz. Next, pulse lore of tantric literature. Pulse also correlated with the tantric study. The Ayurveda has been derived from the Tamil Siddhas. Dwarkanath observed in so far as the Indian pulse lore is concerned, its origin and development may have to be treated to the only source, which is the earlier Tamil Siddhas of the south. Next, please. यहाँ तक हमने देखा कि मिडिल पीरियड में जो लघु उत्तराय वृत्ति का जो जंक्शन पीरियड रहा, उस दौरान डिफरेंट टाइप्स ऑफ मेडिकल थेरेपीज आई और उन्होंने अपने अपनी ओपिनियन से अपनी अपनी तरह से पल्स को आइडेंटिफाई किया और उन्होंने उसमें से कुछ थ्योरीज ने क्लेम किया कि आयुर्वेद की पल्स थ्योरी उनके द्वारा डेवलप की गई. तो आफ्टर दैट जब when Sharandhar and Lagutrai period is start, then they studied the keenly study on the Nadi Pariksha. और after that the एक बृहद रूप नाड़ी का हमें जब बाद में देखने को मिला, जब आचार्य शारंधर ने इस पे स्टडी किया और इस पे प्रारंभ किया, तो शारंधर का जो काल है वो डिफरेंट ओपिनियंस के आफ्टर ऑल लास्ट में माना गया कि उनको 13th सेंचुरी के अंतर्गत माना गया कि आचार्य शारंधर 13th सेंचुरी में हुए थे. नेक्स्ट, उनके स्पेसिफिकेशन पल्स एग्जामिनेशन को लेके. शारंधर डिस्क्राइब द पल्स एग्जामिनेशन condensed only in 8 verses. 8 verses only, they give only 8 verses. 5 verses of beginning deal with the anatomical position of the artery, showing its clinical significance as the pulse. Rest verses deal with the 15 types of pulse, which can be the categorized below. हम उनके काम को 3 कैटेगरी में डिवाइड कर सकते हैं. फर्स्ट, ए, pulse in the certain physiological state of the body. Second, pulse in the certain mental status. Pulse in certain pathological state of the body. तो मेंटल स्टेटस में कैसी है, पैथोलॉजिकल कंडीशन में कैसी होगी, इसके बारे में शारंग द्वारा ओपिनियन दीजिए। नेक्स्ट as you can see, the healthy pulse, steady, strong, स्थिरा बलवती, good hunger appetite condition में लागभिक, चपल, satisfactory after the hunger, स्थिरा. These are the in the normal physiological condition. Next next please. In the condition, ये different type of conditions, lust and hunger, rapid यानी वेगवती, anxiety यानी mental status, anxiety and fear में क्षीणा, poor appetite में मंद, intoxic condition heavy या गुर्गी. This is the symptoms, sign and symptom. They also in the pathology condition, fever में very hot and fast, death, sleep and silent and cold. These is the 15 features according to the Sharangan of the Nadi. Next is भाव प्रकाश का टाइमिंग की बात की जाए तो इनका टाइमिंग अप्रोक्स 16 सेंचुरी का इनका टाइम ड्यूरेशन माना गया और दे एक्सप्रेस देयर knowledge about the Nadi. Bhav Mishra has considered his work related to the pulse examination in the 12 verses. 12 verses, 15 types of the pulse have been described. The whole of the verses can be read under the following heads. First, specification of the side and pulse examination in the male and female. First time they noticed, they claim the right hand for the male and left hand for the female. This is the first person who claimed this examination. It's unfavorable condition when it is not examined. Relation between the finger and different position of dosa. First time Bhav Prakash related the Tarjani, Anamika and the Tarjani, Anamika, Madhyama or Anamika related to the Vat with Kapha dosha. First time they prove this theory that these three fingers correlated with the doshas. Pulse in the physiological condition, pulse in the mental status, and pulse in the pathological condition, same as the according to Sharanga. Next, we can see that as we previously said, the healthy condition, sthir and balwati, as appetite, chapal, satisfactory after the eating, appetizing, sthira, lust and anger, Devati, anxiety and fear, as same. Next, according to Vikriti, Kafja, Sannipata, Vat Kafja, Vat Kafja, they slow, speedy, curl, jumping like a frog, very hot and fast. In the pathological condition, we can see fever, very hot and fast, poor appetite, slow, death pulse, slow sleep from the position of extremely tables. Next, after that, the Yogatnakar era, most of the opinion they claim after 18th century is a expected their century time duration of the Yogatnakara. This is the references of for the time duration fixation. Next, pulse examination. Description of pulse in Yogatnakar is condensed within 48 verses. They 48 verses slok they written in about the Nadi. 33 varieties pulse are the clinical importance, among which 14 types are completely devoted to the describe of the prognosis and death. One type indicated good prognosis. 18 varieties deal with the characteristic of pulse in some physiological and other general pathological conditions. The whole pulse lore can be considered in further categorization. Indication side and the method of the pulse examination. B. Pulse in physiological condition and mental condition. pulse in pathological condition, and miscellaneous related. Next, pulse in physiological condition, you can see why hunger, appetite, lust, anger. So we can see faster, Vegvati, Chapal, Stira. Pulse in general pathological condition, Vatika में snake like, Petika में crow and frog like, Kafja, snake, pigeon and swan like, or all of these are according to Dvidosha and Sannipata. Next, this is learn है due to some. Next, you can continue. Next, bad prognosis. Next, we can say the bad prognosis. Nine, please back please. First time he claimed the time duration of death within 2 days, death within 3 days. Uh, there's a pulse carrying excessive amount of the metabolites and cold to touch indicates death within 2 days. So first time in the Nadi examination he claimed the time duration of death. This is the bad prognosis. This is called the bad prognosis for 2 days, 3 days, 7 days, 15 days, and sudden death also. Uh, Pulse for good indication also. The pulse move like swan and elephant, and the patient is happy. This is a good indication after the recovery. Point number 9. So this is a good indication after treatment. So bad prognosis and good prognosis also claimed by the Yog Ratna. Next, after this, the Kanar. Kanar is basically tantric Kanar. Kanar, uh, Kanar is a tantric whose pulse lore is ascribed in 16 verses. 116 verses, and they can be broadly be divided into following. First, a general consideration of the origin of Nadi and examination of pulse. First time he considered the origin of Nadi. Where is the origin of Nadi? Characteristic of pulse after taking different kind of food stuff. First time he also present the we can identify the food what you eaten. Characteristic of pulse in the physiological condition, pulse in mental condition, pulse in prodromal symptoms, pulse in general pathological condition and disease, pulse indicated bad prognosis, good prognosis, pulse characteristics pro appearing apparently to bad prognosis. Next, general consideration of origin Nadi examination pulse. First time they claim there are the 3.5 crore of nadis, thick and thin in nature lying in the body. They are tied in the region umbilicus, Navi Pradesh, from where they spread obliquous downward and upward. Again, 72,000 of them are thick and are attributed to convey the essential element to 5 sensory organs. These are known as the arteries, the dhamni. Among these arteries, again, there are 700 veins, sira, 700, which are also hollow inside and contain countless microscope pores, which pours out the essential constituent of food required to the body. And also, these veins having been spread in every direction in the body. This is the whole body like a drum, rhythm, a musical instrument. तो we can consider that कि अपनी हमारे पूरी शरीर में 3.5 करोड़ नाड़ियां हैं जो एक्सपांड हैं और पूरा शरीर एक मृदंग जो एक स्थिर रूप से बंधा होता है, उस तरह से इसने नाड़ी संरचना का अनुमान किया. इसी ओपिनियन में एक और उन्होंने बोला कि हमारी नाड़ियां कुछ कच्छप या टॉर्टोइस स्ट्रक्चर की होती हैं, जिनका नाभि प्रदेश में जिसका हेड ऊपर की ओर होता है कच्छप का, वो मेल बॉडी के लिए होता है, और जिसका हेड नीचे की ओर होता है वो फीमेल बॉडी के लिए होता है. तो ऐसा भी इनका ओपिनियन रहा है कि नाड़ियों की पोजिशनिंग के आधार पर. नेक्स्ट, पल्स आफ्टर टेकिंग डिफरेंट फूड स्टफ. जैसे ये भी फर्स्ट टाइम इंट्रोड्यूस किया कि आपने क्या खाया उसके अकॉर्डिंग जो नाड़ी किस तरह से वेरी करेगी. जैसे ऑयल या ऑयल सप्लीमेंट खाने पे इससे पुष्ट हो जाएगी. मीट सप्लीमेंट खाने पे लाइक रोप स्टडी, Sweet food खाने पे jumping like a frog, banana etc. Sometimes turbulence, yeah, like jumping, grains or rice खाने पे steady and slow, पुष्पांड मूली आदि खाने पे slow, green leaves supplement खाने पे resembling the movement of the pulse filled with the blood. So this is the some example. Next, pulse in some physiological conditions. So physiological conditions same as it the before we discussed it. Mental status also the same we discussed before it. Next, pulse और प्रोडर्मल एक्चुअली पूर्व रूप, किसी भी व्याधि के पूर्व रूप के लिए भी आचार्य प्रणाम द्वारा पूर्व रूप बताए गए. Lassitude and the allied pain in the body when fever is occurs, slow and jumping. If fever is about in the increase, so jumping, falling, sunny pathaj में miscellaneous movement यानी uncertain movement. Pulse in the general pathological condition and disease. वही वार्तिक पित्त कफ में वही हम सर्प के वो तरह frog and like a hunts and swan pigeon like. So this is the same as it is we discussed further. Next we can. This is the all references. The continuation of references. This is the clinical. This is the symptom and sign symptom and is features like the Bhuj fever moves forcibly like flooded river. So this is a symptom. Each and every have fever condition, diagnostic tools we can use. This next. This is a feature continue with the it's going up approx 50 to 60 character. We can't discuss here at that time. Next, continue, keep continue. Pulse indication, bad prognosis. Bad prognosis हम पहले बोले अरिस्ट के लायक, जैसे कि when all the three doshas are the fault at the same time. Three दोष fault होने पर slow, tremulous, steady, very feeble. When all the three doshas are fault at the same time, pulse looking quite prominent, very slow, thick, like a rod, feeble movement. So this is the symptom we can assume, we can feel as when we go for the practicals and live demonstration. So this is a type there is also indicate about that Acharya Kanat. Next, this is a continuation of the bad prognosis, death within 3 days, death within 4 days. Already we discussed it. Next, pulse characteristics for the pulse according to bad prognosis. The bad prognosis कंटिन्यूशन में है, उसी के कंटिन्यूशन में है जो हमने बहुप्रकाश में देखे. सेम, always due to the habitum carry blood painting. Next, pulse for good prognosis. Good prognosis to show the patient recovering safe. Yeah, patient have a good condition. There's a good prognosis if the pulse is quite thin, appearing like thread, but don't leave their original position. That means the patient is in good condition. He recover completely. So this type of nadi, we can see the patient is in good condition. It is a good sign for a. So that's called the good prognosis of the nadi. Next. Next, continue. We can continue for next. This is the sixth. हियर हम अपने यहाँ पर जो लघुत्रयी बृहत्त्रयी में बताए गए हमने सभी तरह की नाड़ियों के रेफरेंसेस देखे, श्लोक देखे, उनके रेफरेंस देखे कि किस तरह से उन्होंने नाड़ियों पे इतना बारीक से बारीक एक एक फीवर और एक एक मृत्यु मतलब अरिष्ट सूचक नाड़ियों तक के बारे में अध्ययन किया। बट अगर हम अपने शरीर को देखें तो ये नाड़ी का उद्गम या ये पल्स जो हम देख रहे हैं ये किस सिद्धांत पे बन रही होंगी। हम अपने शरीर को वी कैन सी द हियर, जल महाभूत सबसे शरीर में ऊर्ध्वभाग में रखा है, अग्नि मध्य में है और वायु जो है सबसे अधोभाग में माना गया है प्राय रूप से। अगर इसको हम देखें तो हमारा जो शरीर है वो अगेंस्ट द ग्रेविटेशनल फोर्स के अगेंस्ट सेट है। नॉर्मली फिजिक्स का सामान्य सिद्धांत कहता है कि अगर हम नॉर्मल रखें तो वायु को सबसे ऊपर होना चाहिए, फिर अग्नि को होना चाहिए और सबसे नीचे जल महाभूत को होना चाहिए। ये ग्रेविटेशनल फोर्स के अकॉर्डिंग सामान्य सिद्धांत है। बट हमारे शरीर का स्ट्रक्चर हम देख रहे हैं कि जल महाभूत जो ग्रेविटी में ज्यादा है वो ऊपर है, उसके बाद अग्नि है और उसके बाद वायु है। तो इस तरह के स्ट्रक्चर को बैलेंस करके रखना मैंडेटरी होता है, क्योंकि इसमें अक्षांश चेंजेस भी, हल्के से वेरिएशन भी हमें हमारे दोषों को विकृत करने के लिए या शरीर को समदोष समस्थिति में बनाए रखने के लिए दुष्कर हो सकते हैं। क्यों? क्योंकि हमारा जो बॉडी स्ट्रक्चर है या जो दोषों की हमारे शरीर में स्थिति है वो ग्रेविटेशनल फोर्स के अगेंस्ट। इसमें जल ऊपर है यानी कफ, मध्य में पित्त है और अधोभाग में वात रखी। और इसमें जरा सा भी वेरिएशन, किसी भी तरह के वेरिएशन होते हैं तो उसको प्रोग्नोसिस या उसको डायग्नोस करने के लिए ही नाड़ी एक ऐसा माध्यम है जो हमें तुरंत इंडिकेट कर देता है कि शरीर में होने वाले वेरिएशन या शरीर में होने वाले परिवर्तन के इंडिकेशन को वो तुरंत हमें इंडिकेट करने में मदद कर पाता है। क्योंकि हमारा बॉडी के स्ट्रक्चर जो है अगेंस्ट द ग्रेविटेशनल फोर्स के ऑपोजिट है। तो शरीर में को सम या सम स्थिति में या समदोष स्थिति में बनाए रखने के लिए हमें जो हमारे ऋतुचर्या स्वस्थ के जो पालन के नियम बताएं उनको हमें प्रोमिनेंट रखना पड़ेगा। और अगर हमारे शरीर में किसी भी प्रकार के मिथ्याचार होगा तो जो भी वेरिएशन होंगे वो तुरंत बॉडी में इंडिकेट होने लगेंगे और वो तुरंत इंडिकेशन जो है वो नाड़ी के माध्यम से या हम जो नाड़ी में जो सिम्टम देखने को मिलेंगे उससे हम व्याधि बनने से पूर्व ही हम उसको जो है शरीर में देख पाएंगे। नेक्स्ट, ये मेरी ओपिनियन थी नाड़ी को लेके कि क्यों नाड़ी इंडिकेट कर पाती है शरीर के सभी सिम्टम को। मैकेनिज्म ऑफ पल्स फॉर्मेशन, हम पल्स को भी देखें, अगर ये हमें पता है कि सिस्टोलिक प्रेशर से हमारी पल्स डेवलप होती है और 120, 80 और पल्स प्रेशर 40, ये एक हेल्दी व्यक्ति के लिए इन तीनों का रेशो सेम रहना जरूरी है। ये सिस्टोलिक, डायस्टोलिक और पल्स प्रेशर 120, 80 एंड 40 रहना मैंडेटरी, ताकि वो एक उसका हेल्दी बार है कि यहाँ पे वो शो होता है कि वो व्यक्ति का इंटरनल जो प्रेशर है वो मेंटेन है। तो फिर as a regard function of the vessels, dischargeability of the vessels is governed by their content of elastic and collagen fiber of smooth vessels. We have seen the previous discussion the large, medium, and small vessels. Samson Wright in 97 says that due to the high elastic property, aorta and its large branches are termed to Windkessel's vessels. Systolic ejection distend aorta at its larger branches subsequently to the closer to the aortic wall at the termination of the systole of the left ventricle of the heart. The elastic recoil the vessel sustain their pressure hand better than the redden the blood flow to the peripheral center that is would be otherwise potent. Windkessel effect कहता है कि पोटेंशियल एनर्जी कन्वर्ट होती है काइनेटिक एनर्जी। सिस्टोल के द्वारा जो भी फोर्स आर्टरीज में स्पेंड किया जाता है वो पूरा का पूरा फोर्स जो है आगे फर्दर जो है फ्लो ना होकर आर्टरीज के या रेडियल आर्टरी या आर्टरीज के एंड पार्ट पर कुछ मात्रा में वो स्टोर्ड होकर रह जाता है। उस स्टोर्ड एनर्जी को हम पोटेंशियल एनर्जी बोलते हैं और वो पोटेंशियल एनर्जी ही फर्दर चेंज होती है काइनेटिक एनर्जी की फॉर्म में, जो कि फर्दर जो है पल्स फॉर्मेशन का काम करती है, और जो पोटेंशियल एनर्जी है वही फर्दर काइनेटिक एनर्जी के रूप में कन्वर्ट होकर हमारी पल्स का फॉर्मेशन करती है। तो सिस्टोलिक प्रेशर मैंने बताया, सिस्टोलिक डायस्टोलिक प्रेशर 120/80 है, और पल्स प्रेशर जो है रिमेनिंग लास्ट तक रहते वो 40 mmHg तक रह जाता। नेक्स्ट, this is the continuation of these. Or after that, there is a 20 pages for references. So I think I conclude my topic here. Next 20 pages are the references quotation for which whatever we discussed previous, they are the references of these subjects. Please, I conclude my topic here. Within a time, I try my best to complete my topic within a time.
Thank you, sir, for giving brief knowledge about history, origin of Nadi Pariksha and examination of Nadi Pariksha, and also view of Nadi Pariksha in different countries. Thank you very much, sir.
Thank you.
Feedback link will be given on YouTube chat box. I would like to introduce next speaker of our webinar, Dr. Sheetal Roman, Professor and PhD scholar in KRIYA SHARIR, D.Y. Patil College of Ayurveda and Research Center, D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. She is having 16 years of PG UG teaching experience and 13 years of PG teaching experience in KRIYA SHARIR. I request Dr. Sheetal Roman ma'am to continue her topic, that is importance of Nadi Pariksha in Chikitsa. Please, ma'am.
Am I audible now?
Yes, ma'am.
Okay, I'll start my presentation. I thank the organizers for giving me the topic of importance of Nadi Pariksha in Chikitsa. So as we all know that Nadi Vaidyas, they perform the Nadi Pariksha first and then decide the diagnosis and then further do the Chikitsa. The learning objectives of this session will be: what is the Parikshan Vidhi? Why a Nadi Vaidyas or the Vaidyas should perform the Nadi Pariksha? History of the Nadi Pariksha Shastra. What are the indications of the Nadi Pariksha? What are the contraindications? Disease diagnosis through the Nadi, Asadhya or Arishta Nadi. We very well know that it is the vital flow of energy or life that courses through a subtle channel all over the body. And it also enables the Vaidya to feel the way the blood spurts from the heart. It understands the vibratory frequency of the pulse at various levels on the radial artery at the wrist that signifies the presence of life. It is the most non-invasive diagnostic technique whereby the use of 3 fingertips only and pulse of the patient can be achieved within no time. So the Pranabhisar Vaidya must examine the patient's Nadi for understanding the body constitution, that is Rogi Prakriti, disease constitution, that is Vyadhi Prakriti, and humoral constitution, that is Dosha Prakriti. We all know that it is one of the traditional methods of performing health assessment. Darshana Sparshana Prashnaihi Pariksheta cha Roginam. A successful pulse reading involves touching, feeling, observing, and experiencing the rate, rhythm, and the volume of the pulse. Also, the movement amplitude, temperature, force, and consistency of the pulse should be measured while examining the body. We all know that Sparshana Pariksha, it is the simply feeling that gives us several modifications taking place in the pulse. For that, the physician has to palpate the pulse of the patient with 3 fingers, placing the index, middle, and the ring finger on Karangushta Moola, that is forearm, 1 finger distance from the Angushta Moola for 3 times by giving and releasing the pressure alternately on it. Now, Kala is also important. When should one perform the Nadi Pariksha? It should be done early morning in first 3 hours of morning after Malamutra Visarjan to have the parikshan of Swabhavik Gati of the Nadi of that particular patient. Site of parikshan, it is said in the Granthas that in female, left hand pulse should be examined, whereas in males, the radial pulse of the right hand should be examined or palpated. For that purpose, the Nadi parikshan, the physician should be in the state of mental stability and peace of soul and mind. The physician should examine by his right hand the pulse lying 1 finger in breadth below from the root of the thumb. At the same time, the patient should be made at ease by placing the elbow slightly flexed to the left. The wrist should be slightly bent to the left with the fingers distended and dispersed. Now, why to perform the Nadi Parikshan? It is essential for the assessment of many health parameters, that is physiological as well as pathophysiological parameters, like to understand the gati of the nadi, whether it is manda or a vegvati, guna, nadi guna, like whether it is a sama or nirama. Also, in guna, we can take the sparsha, that is ushna, shita, then the dosha avastha, that is predominant dosha avastha at that particular point of examination, subdosha vitiation, then vikruti assessment, then agni to understand the position of agni in the body, then bala, interpretation of bala from nadi, to understand the dhatugata avastha, hetu jnana, that is the predictive or the causative factors with prominent guna and dosha are reflected by the nadi. Even the manasa bhav, that is bhaya, chinta, kama, krodha, they can have different effects on nadi of a person. Now, what one understands through nadi? We all know that nadi parikshan requires expertise who has long experience and skill of reading the pulses for any disease diagnosis. Howsoever, it is a skill that can be nurtured and acquired by continuous practice, that is sadhana, along with guidance from the experts in the nadi parikshan. If we see the history of nadi in Bruhatrayi, only spandana, praspandana, and aspandana are given, but not focused diagnostic or prognostic nadi examination is established or explained. Whereas in Lagutrayi, Sharangdana for the first time has been mentioned 15 types of nadi that include the physiological, psychological, and pathological states of the body. Those were correlated with the birds, reptiles, and amphibians. Also, 24 notable nadi are described for the nadi pariksha. One kind of messenger pulse, that is Duta Nadi, is also popular in Andhra Pradesh, wherein from the Duta's Nadi examination, they understand the severity of the condition of the patient, and further they can plan for the chikitsa. Also, in Bhava Prakash in 15th century AD, it is given that the gender-based Nadi has been explained and the 3-finger usage for the Tridosha. In 16th century, Yoga Ratnakara included different sites and methods of pulse examination and prognostic as well as diagnostic methods. Basavarajiam, it has mentioned the Ashtasthanas of Nadi and diseases. The primary of them are the wrist, that is radial artery, neck, carotid artery, and nose, that is facial artery, a branch of facial artery. The other 5 areas where the Nadi is witnessed are the ankle, tibial artery, pudendal, the brachial, superficial temporal, and supraorbital. The Grantha called Vaidya Chintamani, it has mentioned Ajirna Nadi along with the Dosha Nadi. And in Ravana Tantra, that is Ravana in his Nadi Vidyan, he has explained the Nadi Pariksha, including after taking certain diets along with prognosis, physiological, psychological, and pathological conditions. Even Kanada in his Grantha called Nadi Vijnana has given general consideration of origin of Nadi and its examination. He has explained pulse characteristics after different foodstuffs, the different foods like after eating meat or lagud akruti like rod legs or steady, the Nadi is observed. Also, Nishakaram Vata Pitta Rupena, that is, it resembles the pulse of Vata Pitta but maintains no order at all. We all know that this pariksha or examination, it forewarns us about the potential health risks. It gives us the insight to optimize the health in accordance with the elements which are predominant in our body. By providing the personalized and individual prognosis, it gives us the detailed and accurate interpretation of the health status. Also, in some cases, the renowned Vaidyas can identify the chronic diseases like diabetes, infertility, obesity, hypertension, paralysis. In such cases, the Nadi Pariksha is important to plan the chikitsa accordingly. Also, 7 different levels from vertically downward, the subtle variations are observed. They can be interpreted as the first level gives us the dosha at the gross. The second level interpretation is the dosha at the sub level, that is the subtypes of the doshas. The third level of interpretation is the dosha which has to be targeted when one is opting for panchakarma. The fourth level is the interpretation of the dhatu or the organ involvement, that is srotas, which has to be targeted to treat. The fifth level is the interpretation of upadhatu. Sixth level, we can understand the interpretation of mind. And the seventh level is the interpretation of the constitution. The Nadi examination, we can classify into 3 types: predictive Nadi diagnosis, diagnostic Nadi diagnosis, and dynamic Nadi diagnosis. The predictive Nadi diagnosis can be used for the Prakriti assessment, which is a proportionate one. The diagnostic can be used for understanding the diseases by different static principles of movements described in this text. And the dynamic is used for understanding disease and prescribing medicine or procedure. Now, what is predictive? It is superficial in nature. It only gives us the rate, rhythm, blood vessel, consistency, etc. It is commonly used for dosha involvement, colloquially in disease interpreted with movement of the various animals. By the index finger, one can interpret the vata. The movement resembles that of the snake or the earthworm. The middle finger establishes pitta dominance, and the movement resembles frog or crow. And the ring finger establishes kapha dominance, and the movement resembles the swan or the pigeon. So again, the predictive Nadi diagnosis, the vata pulse can be felt as fast, feeble, cold. It is light, thin, and it disappears on pressure. It is felt under the index finger. The pitta pulse, it is felt prominent, strong, shows a high amplitude, it is hot, and it forcefully lifts up the palpating finger. Whereas the kapha pulse is felt as deep, slow, broad, thick, cool, regular. If we consider the doshic imbalances of Nadi, if there is Vata Nadi imbalance, it can lead to excessive dryness, atirukshata, sleeplessness, impatience, mood fluctuations, also some kind of skin conditions like psoriasis, body aches, etc. If there is Pitta Nadi imbalance, it can lead to acidity, gastritis, ulcer, hair fall, feeling more angry, feeling of being disturbed. When there is Kapha Nadi imbalance, it can lead to obesity or being overweight, diabetes, thyroid, polycystic ovarian disease, and in turn, knee joint pain, varicose veins, laziness, and various metabolic disorders. Now, if we consider the Doshika Jvaravastha and Nadi, which has been explained in the Grantha, the Vataja Jvara, the Nadi is Vakra or curvilinear. It is unstable, that is Chapala, and cold on touch. In Pitta Jvara, it turns out to be rapid, straight, and of long duration, whereas in Kapha Jvara, it is slow, stable, cold, and sticky. If we consider the Dvandavaja types, the Vata Pitta Jvara, it is somewhat Vakra, Chapala, and Kathina. In Vata Kaphaja, one feels the Nadi as being Manda, and in Pitta Kaphaja, it is Sukshma, Shaitya is there, and it is Sthira in nature. If we consider the second type, that is diagnostic Nadi diagnosis, it is based upon the various examples given from the text to know the disease or the condition. It is the main basis of its understanding is on gati or momentum of the Nadi. The different examples are given resembling the momentum of the insects or the animals. Now, in the Krumi Gati is of the Nadi is found specifically when the person has parasitic infestation or the worm infestations. The Pippilika Gati can be felt when there is terminal illness. Mayura Gati in arterial hypertension. Kukuta Gati in diabetes or albuminuria is existing in the body. Ushtra Gati, aortic stenosis. Gajagati, it can be seen in elephantiasis or the lymphatic obstruction. Girija Gati in heart block conditions. The Vishama Gati of the Nadi, that is mainly seen in pulsus alternans or atrial fibrillation. Damaru Gati, it can be a part of fatal illness, renal failure, or shock. And Padma Gati is the normal one, which explains the perfect health or the enlightenment. The pathological conditions of the Nadi, we can understand in Jvara, it is found to be Gambhira, Ushna, and Vegavati. In Kama and Krodha, that is during these emotions, it is very rapid, Vegavaha. In Chinta or Bhaya, it is Kshina. And when there is Mandagni and Kshina Dhatu, it is again Manda. It is found to be Ashruk Purna when Ushnata of the body or the heat of the body is increased. The Nadi will be Ama. In Ama condition, it will be Guri and Gariyasi, that is heavy and tense. In case of Ditagni, it will be Laghu and Vegavati. When one is Kshrita, that is hungry, it will be very Chapala. When Trishna is there, it is stable. When Trupti is there, it is Sthira, and in case of Asadhya Vyadi, the Nadi will show more Kampana and Spandana. It should be remembered that it has a tendency, that is the following facts. We can see variations and then after the heavy meals, in sitting and standing postures, while walking, physical activity, exposure to sun, mental conditions like sexual excitement, seasons like Grishma Rutu. All these conditions, they show different kind of variations in the pulse. So it should not be examined. There are certain contraindications when not to examine the Nadi. They are just after taking the bath, Sadhya Snata, just after taking food, Sadhya Bhukta, after internal and external oleation therapy, that is, after having Sneha Avagahan, during hunger, thirst, and during sleep or just after awakening, Nadi is not to be examined. When Vaidya is supposed to examine the Nadi, he or she should not be Madhyapita, Mala Mutra Vega Yukta. The Vaidya should not be Chanchala Atmaja and Lobhakranta. Also, Asadhya Nadi has been explained in various granthas. When it is said to be Asadhya, the displacement of Nadi from its own place, and when it is moving very slowly, it indicates that the patient's poor prognosis there. Also, feeble and cold pulsations definitely kills the patient. When the Nadi firstly pulsates like Pitta Jagati, afterwards it will become like Vata Gati. and then converting to kapha and moves like chakra. It is sometimes rapid and sometimes manda. Such nadi is considered to be asadhya one. And last, the nadi, which resembles a damru, a musical instrument which is strong at the opening and ending, but in between which is very slow. It is mrityu suchak nadi. We all know the instrument called Nadi Tarangini has come into highlight. Even though it is technologically advanced, there are certain limitations. This instrument basically works on the mechanism that serves the purpose of converting mechanical wave generated due to the movement of bloodstream in the radial artery into the electrical wave. The main sensors used are the microphone to pick up the mechanical vibrations and optical sensors to obtain the pulse waveform. Even though they generate quite a lot amount of data and it is helpful, still we can say a drawback is there that there is no mechanism to generate the external pressure on the radial artery. As I have told you that the Nadi Vaidyas, they apply certain pressures on the artery and it is examined thrice to understand and illustrate and interpret the subtypes of the doshas. So this it is what I feel is the drawback in technological advancement. Still, we can say that it is useful. Also, there is a saying that Jnana Buddhi Pradipena Yo na Vishati Yogivat Rogina Santaranam Nasa Rogan Chikitsate. It means that unless the physician's intellectual enters, that is, understands the patient's inner self with a sharp sightedness as a yogi, a physician cannot treat health issues. And here, the Nadi comes as a channel between the physician patient interaction and relation. Ravan Tantra quotes that pulse is like a lamp that throws light on all the physiological and pathological states that are encountered in man. So, I would rather say that there are various benefits of pulse analysis, which include detection of imbalances at an early stage, that is, prevention is better than cure. Detecting the root cause of the imbalances, also restoring the balance through proper herbal supplements, diet, daily and seasonal routine, various yogic postures, breathing exercises, meditation, and some natural physiological cleansing processes or detoxification programs. They can help in uh, treating the patients. So the chikitsa aspect, it can also be taken care of by the Pranabhisara Vaidyas by understanding the Nadi. And to conclude with, I would like to thank the organizers for giving me this opportunity and to share the knowledge which I had regarding Nadi. And I am also learning more in this stream of patient examination. Thank you.
Lots of thanks to you. Tamsoma Jyotirgamaya. We have a darkness in your mind regarding Nadi Pariksha. You have enlightened our brain with your proper knowledge, deep efforts, and sincere efforts. I'm very happy that you have learned all the topics required regarding this. Just starting from how to analyze the Nadi Pariksha, how to prepare Nadi Pariksha, why to prepare Nadi Pariksha within different Vyadhi Avastha, Rugna Avastha, and all other aspects you have covered very well. So I'm very, very thankful to Dr. Sheetal Roman Madam, and I'm hopeful for further interaction on this topic. I'm telling all the students that first one you have to learn that, lastly, Madam emphasized on that, we have to study from our heart with our full concentration. Then and then only we can master our Nadi Pariksha. Just our Shastra says an Ashtavit Nadi Pariksha is the first point that is mentioned in Yoga Ratnakara. But ultimately, it is not dependent on any mechanical parts or mechanical machinery. It depends only on the sensory effects and intellectual that a physician should get from the recurrent abhyas. Satat abhyasanam is most important point in a Nadi Pariksha. So I'm very happy that Sheetal Raman madam has emphasized on these points that we are expecting. Likewise, Dr. Sharma sir has his own efforts regarding his history of the Nadi Pariksha, different diseased condition or other additional conditions that Patil Sharma sir has emphasized on that. I'm very, very thankful to both of our eminent speakers and helping for further interaction with both of them. I'm again thankful to Honorable Nishikant Dada Patil for creating such a great platform that we can serve through this platform to all the community, all the teachers and all the students. So I'm again thankful to the Honorable Nishikant Dada Patil. Then I'm thankful to our Dean Sir, Dr. Minkire Sir. He's a professor in Shalya Tantra and a Dean of our college. I'm very, very thankful, sir, for your great helpful nature. I'm again thankful to our chairman, Sri Sanjay Jadhav sir, Secretary Sri Nitin Patil sir, Sri Sandeep Patil sir, our PG Director, Dr. Pramod Kanaf sir, PhD Director, Dr. Ajit Patil sir, our department's Associate Professor, Dr. Dipali Patil madam, all technicians and all other non-teaching helping aides. They have helped us a lot for conducting this beautiful webinar. And again, I'm concluding this, my webinar with the words of thanks to all of you. Thank you. Kindly give your feedbacks in the link provided in the YouTube, at the end of the YouTube link, YouTube chat box. Okay, thank you.